She said, thank you for bringing all of us on a common platform and we could understand the issue better. Today, what we are going to do is once again an effort in the same direction. And then she said, nobody said anything negative. And that's my promise today as well. We are not here to point fingers. We are only here to find solutions to problems. And we'll find it in a wonderful way. It'll be a wonderful and pleasant journey. And then she said that she couldn't leave the session because it was so engrossing. And I hope, Ms. Mona, that we are able to keep you as well. So welcome everyone, uh, and greetings from my side. I am Raman Arora, and I'll be introducing myself and our work that we are doing in uh, uh, Chamarajanagar. And I take this opportunity to thank the DTO, Dr. Ravi Kumar, for allowing us this opportunity. Uh, Dr. Ravi, would you like to make any initial remark and then I will take over? Dr. Ravi, can you hear me?
No, please carry on, carry on. I welcome everyone and I thank everyone for joining. So please go ahead, sir. We are already behind schedule.
Okay. So perfectly fine. And today we are together to discuss the multisectoral approach to make Shamraj TB free. That is the objective. And multisectoral, but today we are only private practitioners and pharmacists and chemists who have come here. Prior going ahead, uh, let me just introduce myself to you and then I'll introduce my colleague as well. I am Raman Arora. I have retired from the Indian Navy. I took voluntary retirement, but I still feel proud to showcase myself in uniform because I am still a soldier. I've been Director Naval Operations at Naval Headquarters, and I am very proud to share that after the Ajmal Kasab incident in this country, the entire coastal security of this country, I took care as the Director Naval Operations Coastal Security. I have been Naval Advisor to the Director General Indian Coast Guard. I've been faculty and research guide to Defense Services Staff College, Wellington. Dr. Ms. Mona, if you may be aware of this institute and probably you would have been privileged to attend also. This is where I did my mid-level management course with IS officers, with IS allied, with central government class A, with military and paramilitary, and then went back as instructor to the same institute. I was privileged to do so in Army War College as well in Mahu, where I was the first and the youngest Commodore ever to get this coveted appointment. And I'm very proud to share that perhaps I was the youngest in the three armed forces to get this appointment. I am talking like this not because of ahankar, not because of aham. It is just to let you know that why we are here. I have been part of Op Vijay in Kargil War, as well as Op Parakram and Parliament attack. I call myself a transformation leader. I have dedicated myself to the social work along with my colleague, Dr. Manoj Jain, who's joined us from America. He is in, are you in Boston or Atlanta? Right? Where are you?
I'm near Atlanta at the present time.
Okay. Dr. Manoj is an infectious disease physician. Though he is an NRI, his heart lies in India. He is from Indore. I'm also from Indore. He keeps coming every 3 months to the country, goes back to the slums, and he has taken a vow to eliminate tuberculosis from this country. He is also referred to as Dr. Fauci in of Memphis, a great writer. He writes for the Washington Post. He is an ardent follower of the Jain philosophy. He talks of nonviolence. He has written many books and many publications. There are BBC and Fox News, serial series going on for him. He's taken advice of and consulted by the health minister of the country as well as the state. So it's proud to introduce him. And our third colleague, I don't think Manoj, welcome, and I'll be
Yes,
asking you
thank
to
you so much.
share your vision after some time. Our third colleague, Dr. Salil Bhargav, he is busy. He has some emergency call, so he couldn't be part of the meeting right now. but he's the head of the department, pulmonary and chest physician, and everything is on the screen for you. Why I am sharing our credentials is not to emphasize that we are such important people. It is only to emphasize, dear people of Chamarajanagar, that we have achieved, we have been successful. Our kids are all well settled, majority of them are married. We are now thoroughly dedicated to social work, and we have selected Chamarajanagar as our Karam Bhumi for the pilot project. I'll give you a very brief overview what we're doing, and then I'll bring in Dr. Manoj, and then Dr. I have this habit of adding a prefix of doctor before everybody's name. Uh, so I'll get you in, Mona ma'am, immediately after this. Okay, am I there or not there? Can you hear me, anybody?
Yes, very
Yes, sir.
much. Yeah.
Yes, sir.
Okay, Ekta, you started sharing, no? Okay, good enough. So, CAP TB project is nothing. If I have to sum it up in one line, next screen, please. Next slide. Yeah, we are strengthening the DTOs. Our objective is our DTO, Dr. Ravi Kumar, we have to make him into a Superman. Well, how do we make him into a Superman? By making sure that all of us present here, we give him the support. That is actually multisectoral. What do? We bring with us huge amount of expertise in administration, management. We have done it all across the country. We are currently teaching at Harvard. Very proud to say that we are teaching the Harvard scholars right now on the same thing that we are practicing with you. WHO acknowledges us. The Central TB Division acknowledges us. The WHO acknowledges us, our work. So we are wanting to make this DTO a Superman. And today, in the multisectoral approach, we will be asking cooperation of the private practitioners and the pharmacist, such that uh, let me share the screen, team. Let me know if there's any problem. Is my screen okay?
Yes.
Now it is. Yes, sir.
Okay. So our objective is that just in case tomorrow Dr. Ravi plans to do a workspace screening in an industry, we should be able to give him 40 volunteers, which includes vehicle with capacity, MBBS interns, 5 doctors. And this is a real-time slide I'm showing you of a district where we have worked. Okay. Dr. Ravi is only 2 staff and rest all coordinated by just 10 student volunteers, 5 doctors, 10 TU coordinators, 1 ambulance, 1 data entry operator, 2 private practitioners, 1 private physician, and more committed people as required. Okay.
Raman, sir, your
So,
slides are getting blurred out.
okay. So in that case, I'll stop sharing. You can start sharing, Ekta.
Yes.
We are looking at a time when how the graph should look like of presumptive. Once again, Chamarajanagar practitioners, private practitioners, and chemists, this is a actual graph, genuine graph of a district where we have worked, like we are working with you. And please have a look how the presumptive is going up, how the presumptive notification per lakh is going up. Next slide, please. This is how the contribution from the private sector has gone up in a district just because we interacted with you. So all I have to say is TB is a very, very old disease. The diagnosis is free. The treatment is free. The government gives money, ration, other facilities to the patients. Yet we have not been able to eliminate it from our country. We will be sharing some very simple thing. We'll be calling for some cooperation. We'll be cleaning a lot of cobwebs which could be there in our minds, because eventually all of us are well-meaning people and we want to devote ourselves. Dr. Manoj, if I may ask you for your vision. Next slide, please. And then we'll be requesting Ms. Mona. By then, you'd have understood what we are referring to, and your meaning, your address will be very, very meaningful to us. Next slide, please. Before that, yes, Manoj.
So great. Well, so thank you so much, Raman, and welcome. Dr. Ravi, what a pleasure to see you. We've met 2-3 times on multiple occasions, and it is truly a pleasure to see so many of the private practitioners. I am a private practitioner. I was born in India. Over the past 50 years, I have lived and done my education in US, but over the past 15 years, I have had a sort of a change in a lot of the workings I've done. I'm not seeing just patients, but I'm also doing public health work and work in India. As Raman said, 3-4 times a year, I am in India, in the slum areas, in areas of rural India, working on how we can eliminate tuberculosis. Now, I want to make sure that we have a clear understanding of why we want to eliminate TB. Just think of this. 4 lakh individuals are dying every year of TB in India. This doesn't need to be happening. This is a disease that we can eliminate, but it requires the private practitioners to be working hand in hand with the DTO and with the broader audience. So with that in mind, the dream that I have, that many of us have, and the dream that we're working with Dr. Ravi and with all of the people in Chamarajanagar, and especially the private practitioners, how can we provide the resources? How can we help all of the individuals there in the private sector, public sector, to get the TB resources to eliminate this disease in Chamarajanagar? We have a wonderful grant from Asha Haste Trust. Mr. K. Dinesh, who's a close friend, is the donor from Infosys. We really appreciate all of that work. So thank you so much, Dr. Ravi, for your work. Ms. Mona, for being with us. Great work. Also, our district health officer, Dr. Chidambra. Thank you. And also Dr. Shilpa Neg, our deputy commissioner and district magistrate. Your contribution and support goes a long way. Thanks, everyone. Looking forward to the conversation.
Thank you, Manoj. Dr. Chidambra, can you hear me?
Yes, sir, I'm hearing.
Yes, Dr. Chidambra, can I request you for your kind words, and if you've heard about the project, and how would you like to see TB getting eliminated from Chamarajanagar? And we from CETI assure you that we make things happen. We are a catalyst. We have done it across the country. So I want to hear from you, what are your thoughts and how would you see it happening? And what kind of support would you expect from the private practitioners and the pharmacist? Over to you, sir.
Good evening to all. In Chamarajanagar, as per the national guidelines and state guidelines, with the help of district administration and with the support of all the other stakeholders, including private practitioners, and the effort of district health team led by Dr. Ravi Kumar. So the program has been launched. It's going smoothly and it's effective. Everyone can appreciate. Compared to previous 3-4 years, the program has picked up its pace, and we are seeing we are picking the maximum cases, and we are in a position to cut down the transmission rate also, and the case holding and the treatment and taking under the notification from the private practitioners has been increased, and we are and overall the comorbid conditions has been cut down, and the death statistics also has been reduced. But the main thing we are facing, and we request the other stakeholders or anyone who are involved in TB elimination or eradication, the thing is, so we can pick the cases and treat, and we can limit the transmission in their area. But overall, the chain of transmission has not been cut down. So anything which can be done to break the transmission chain, that will be the better thing. Unless, as everyone knows that tuberculosis is an infectious disease, everyone will get infection. Of course, a minimum persons will get the disease. But once because today, as per many economic factors, there is the immune system, the immunity has been coming down at every person. So this tuberculosis with the multi-drug resistance will become the major concern in future. So for that, the breakdown of the transmission chain will be the most effective one as per my practical aspects. So I request the dignitaries to concentrate on this rather than picking the cases, and those things will be done from the department and from the as per the national guidelines. So please, I request everyone to focus on this. And with this note, I thank you all for involving us in your work and involving you with our work. I thank you all. Thank you.
Thank you, Dr. Chidambara. Thank you so much. And I have made a note of your observations. Ms. Mona, can you hear me, ma'am?
Hello. Good evening. I can hear you.
Yes, ma'am. Good evening. Ma'am, we are also working at the panchayat level. We have gone into villages and we have a plan how we can collate the collective efforts of everybody possible and work on TB-free panchayats and make Dr. Ravi much more stronger entity. And wherever the resources are short, we will fill those gaps and make sure that we start from bottom up from the panchayats. So first, I take this opportunity to welcome you, and now may I request you for your vision, your views of how we should be working towards making a TB-free Chamarajanagar. And believe me, whatever you would say, we'll put all our efforts to make it happen. Over to you, ma'am.
Very good evening to everyone. And thank you for giving me this opportunity to speak about this TB-free Gram Panchayats. So since we are working at the Zilla Panchayat, Taluk Panchayat and Gram Panchayat, I would say compared to North India, in South India, Gram Panchayats are very effective. So if we want to implement anything, any scheme, Gram Panchayat, if we take as a unit, it will be really helpful for the implementation. Since in our district, we have 130 Gram Panchayats already, as our district officer had given us information last year, 13 Gram Panchayats in 2023, 13 Gram Panchayats got a TB-free status. So this year also we are targeting that most of the GPs get TB-free status. And rather than just getting that status, actually on the field, people should get free from this TB. Already our team is very good. Our health DHO is very good. Our district officer for TB, he is also very good. And they are very effective in implementing schemes and do motivating people also. They are doing very good work. I have joined in the month of July only in Chamarajanagar. So I have seen their work and it is really impressive. So I think if there is a coordination and support from different sections, it will be really effective that we can help in making our panchayats TB free. So personally also, health and education are like my favorite topics or sections, you can say, where I want to contribute or do something really good. So if in real sense, if something happens, and then definitely I'll be personally very satisfied that I have done something. I was a part of it. Not obviously one person cannot do everything, but if there is our support from everyone, from agencies, from NGOs, private doctors, government sector, definitely we can achieve anything. Today morning only we had meetings with our school headmasters. So I would just quote incidents. Last month we had a meeting, so they were not so much motivated. But we had one meeting and now I can see the progress. So it is all the team effort, and it can never be a single person initiative or work. So I would just request that all give us the support, and let's aim for our target and try to achieve it. So that's all from my side. Thank you so much.
Yeah, Manoj, you want to say?
Wonderful. Yeah. So, Ms. Mona, thank you so much. And it's leadership that makes the difference. And your leadership, your hands-on approach to this. You saw the difference from when you were there last time and then when you were here this time. It makes a difference. And Dr. Chidambra, you are absolutely right. We need partners. We need the private practitioners to be with us. Thank you so much.
Thank you,
Thank you.
Ms. Mona. Thank you so much. And I 100% agree with you that the South India is very effective and the Gram Panchayats are effective, and I can put it on record. And I'm saying it from experience because we in CETI, along with the Government of India, have just finished a project all across the nation. We have covered every possible state in the country, including our island territories of Lakshadweep and Andamans and Jammu and Kashmir and Leh and Ladakh. And it has been clearly evident that the approach that the South Indian states are taking are different from the North. I will not go into the reasons, but yes, it is evident. And your view and your wish that we should start from bottom up from the Gram Panchayats, and very happy to hear it. Yes, Dr. Ravi Kumar and Dr. Chidambra have been sparing the leadership along with you. 13 Gram Panchayats have been declared, and Dr. Ravi is very, very proactive about the things. He keeps us briefed as well. So our effort is that if the district administration is looking in east direction, we will make sure that every stakeholder around us is looking in direction east, is putting all the strength behind the district administration, the district health department, the district tuberculosis officer, and its strength. So thank you so much for the kind words. And definitely, myself and Dr. Manoj, when we'll be here in Chamarajanagar, we will look you up, probably look up for a cup of tea with you. Thank you so much, ma'am. And stay put. I know you must be busy. Stay put, because we are going to slowly peel away all the misgivings and misconceptions and make the thing so clear. And probably each one of us present in this session today will feel responsible and feel committed that yes, we can also contribute towards nation building. Thank you so much once again. Dr. Swati Aital, can you hear me? Dr. Swati? Okay, maybe Dr. Ravi, if I may request you, I would like to bring her in. Oh, yes, I think she can hear us. Yeah. Okay, Dr. Swati, I would like to bring you in. Yes, she's unmuted herself. May I request you to share a few words, your observations? You've been watching CETI in all the districts, and what our approach and what we can do, what you would like to see happen, so that before I bring in the private practitioners and the chemists and the ADC and everybody else, they should actually know first what is expected from them. So, Dr. Swati.
Yes. First of all, good evening, everyone, and I thank you, Ramanji, for this opportunity. And I'm extremely happy to see, CEO, DHO, and our DTO sir, so committed and doing this session at this time, and everyone are continuously participating. That is very good to see. And I also want to congratulate our DTO sir. I've been seeing him now since like past 2 years, and he's been very ably leading the team with very good support from CEO and DHO. And now coming to your point, Ramanji, what is expected? What do you want to see? So basically, yes, I have been seeing your work from last 1 year. So what's happening? So I think we already also discussed about it. So we in Chamarajanagar, there is also a steady improvement in presumptive TB examination as well as cases. And as CEO ma'am emphasized on how TB free initiative and all in Gram Panchayat level is also going up. So here I think we have focused on one or two taluks earlier also. Like we had this discussion where where we are seeing low presumptives and low cases, even though we were expecting more cases from that. So probably I would want you to take up those two taluks which we had discussed prior, and I think you had also thought of one of the taluk, and one of it was not included. So you had said that we can bring it up in the discussions and take it up. So that is what major are indicators which goes for TB free initiatives. I think those indicators only, if we can strengthen in these two districts, the in these two taluks, sorry, our entire district will move up. Because presently, as I see, because of one of these two taluks, like we feel like we are still in the average probably among all the districts, if I have to compare. So if these basic indicators strengthen in those areas, if you could join hands with our DTO and ably lead coordinate with the team, then definitely we will see the change, I feel. So that's it, I think, for now. So thank you once again, and hope to see more such activities.
Wonderful. Yeah, thank you, Dr. Swati. And Dr. Swati is the WHO consultant. Wonderful work. And you're absolutely right. We've reviewed lots of the data from Kolagal and Yelander and Hanur, as well as Chamarajanagar North. There is improvement, but we really need to get that presumptive TB examination from each of these TUs and taluks up. So we've been watching this data very closely with Dr. Ravi and his team. So thank you, Dr. Swati.
Thank you, Dr. Swati. Thank you so much. Thank you, Dr. Manoj. And let me share a wonderful, great news with you all. The points that WHO consultant Dr. Swati just brought out, Dr. Ravi has been incessantly working in that direction. And in fact, if you see the screen, Dr. Swati mentioned presumptive TB examination, and Dr. Ravi is going to talk about exactly the same thing. And Dr. Ravi has been so proactive. He has managed the handheld X-ray machines to go into those inaccessible areas, which we were talking about. And he mentioned to us, that he was short of some manpower, and he has been able to fill it up using our resources. And he then wanted some more work people on ground to work in those specific taluks, Dr. Swati, that you're mentioning. And I'm very proud to share that we have been able to provide that also to him. And so I think it is exactly the right time now, Dr. Ravi. We have heard expectations. We have heard about your good work and the support that we're getting from Dr. Chidambara. May I request you to share now your views about how you wish to see the presumptive TB examination going up, and then I will bring in everybody else. And while I do that, I do welcome and greet Dr. Basava Rajendra, our IMA president. Dr. Basava Rajendra, welcome. Can you hear me? Edwin, is everybody centrally muted?
No, yeah.
Hello.
Yes. Yes, Dr. Basava Rajendra, can you hear me?
Yes, sir. Yes, sir.
Greetings to you. Good evening to you, sir, and welcome. And I'll be soon getting you for your opinion and guidance.
Okay, sir. I will be with you, sir.
Thank you so much. Dr. Ravi, over to you.
Able to unmute. Okay. Thank you all. It is so nice of all of you to have participated in this VC at this time, and some good words about me. And it all has come from the encouragement that has been given to me from my district authorities, our DHO sir, and everyone has been very supportive of the program. And as it is pointed out that by our WHO consultant, that we have to improve the presumptive examination to increase the notification And initially, when SETI came into picture, so we picked up 2 TUs and started working there where the notification was low. And applying the PDSA approach, we worked on those 2 TUs, and there was significant improvement in the notification because the presumptive examination rate also increased. Exactly what I want to pinpoint here is for the private practitioners is we have got presumptive examination references from the public and the private sector. Public is our own government sector, wherein we get patient referrals or testings done by 3 methods. That is passive case finding, where it happens in the OPD. Then another one is active case finding, where our health workers go to the field and identify TB symptomatics and send for testing. And also intensified case finding, where we focus on diabetics or malnutrition, people with malnutrition, or alcoholic smokers, or those who are vulnerable to go for TB disease if they already have the infection. So this approach we have got from the government sector. But the private sector, mainly they refer from their OPD. That is passive case finding happens in the private sector. And when we look at the positivity rate, the positivity rate in the private sector is definitely more. Although their examination rate or the presumptive referrals or the TB suspects they send for testing is not so much as we expect to their OPD, their positivity rate is too high. It is almost somewhere around 20 to 30%, whereas ours is little between 5 to 6 because we send huge numbers. So when we are getting such high positivity rate among the referrals from the private sector, they still need to push more patients to the testing centers. Like the government sector, we are already offering molecular testing like CBNAT and TrueNAT free of cost to the patient. Especially in our district, we have given strict instructions that whichever private practitioner sends the samples, it has to go for NAT testing, that is molecular testing, rather than microscopy, so that they are referring in a limited number so that we should not miss the case. So we will continue the same even if they increase their number of referrals. So definitely when their positivity rate is high and more patients go to them in the early stages, or sometimes, even in the times when they are not able to go to the government sector, many of them go and approach clinics or doctors, private doctors who are quite popular. So I don't know why they are, still holding back in referring. So if they refer properly, because in our district, even from rural areas, Chamarajanagar has got a, like almost a semi-rural picture when we look at it as a whole. So almost more than 70% are from the villages or from the tribal areas. So they come to the district headquarters or taluk headquarters, or in some small towns where Hobli level towns are there. So they go to the private practitioners, but private practitioners' referral is not corresponding to the amount of patients they are getting there. Even in other big hospitals. Right now, IMA president, Dr. Basavarajan sir is there. He is having a good hospital, and from his side, we are getting good support. And from Kollegal, we have got Holy Cross Hospital, and then Janani Hospital, and then in Gundlapet, we have got Assisi Hospital. So these are some major hospitals, and there are some few practitioners who are actually sending cases. But even from them, they can increase the numbers. When we look at the picture, it is not so encouraging to say that the reference from them, presumptive examination, a reference from them is satisfactory as per their OPD. Because in the approach in private sector should be about passive finding, passive case finding. So in the OPD, whenever they getting symptomatic cases, they should never forget, or they should keep referring the patients where we do the diagnostics free of cost. That to quality diagnostics we have, and we are doing it free. So that should not, I request them to, I appeal to them to increase this. And we have already made groups, like, on WhatsApp, we have got 3 private practitioners groups where at Kollegal and Anur Taluk, there is one group. Chamarajanagar and Yalandur Taluka have one group, and Gundlapeta has one group where we keep interacting, and our NTP staff also, coordinate with them whenever they refer a patient, and we take care of everything. So when we are asking for that cooperation, they have been cooperating, but I want them to scale it up. Rural patients coming to the towns and going to the private practitioners are a big chunk which will help in TB free panchayat, because rural people, once even if they are getting tested here, they will be counted as an incident case in the rural area only. So it's an important thing that private practitioners do this, and we are there to support in every way. Whatever the program guidelines is there, we will do it. And also it applies for the urban patients as well. So another thing is, as Ramanan sir pointed out, I actually thank our district administration, especially because they provided us the handheld X-ray machine to carry it to the panchayat levels or inaccessible places, where we are now doing it on a camp mode. We are taking the X-rays there, and we are getting good outcome also. And SETI, when I asked them to provide me an X-ray technician, they have been supportive, and they have provided me one X-ray technician, and we have been using the X-ray technician for these camps. And we have been able to screen many people. We have already done some 1,200 X-rays in the outreach sessions, wherein we could diagnose so far around 12 patients, which were confirmed. And apart from that, we have identified around 300 patients who had abnormalities on X-ray, who are being clinically followed up. So the clinical follow-up, if it happens in a proper way, we will be able to pick up more cases.
Perfect.
So this is what I mean to say. So private practitioners' contribution in references should increase in our district.
Okay. So that is the objective. And now I am going to play God. Please allow me. I am going to play God, because there may be some questions, some complaints, maybe some observations in the minds of the private practitioners also. So I will involve the entire panel now. Okay. May I request, Dr. Ankita to show us the panel, and may I request Dr. Chidambara, Dr. Ravi, Dr. Basavarajendra, Dr. Swati, Mr. Harish, ADC, Assistant Drug Controller, Dr. Wasim, TB Nodal Officer from SIMS, and Dr. Sunanda, President of MOGS, and Miss Savita. Miss Savita, you're here. I'm sorry I've not been able to acknowledge you so far.
No, sir. Due to some issue, she was not able to join.
Okay, not to worry, but we will cover her this thing also. So there is a give and take required. And Dr. Basavarajendra, I am going to play the private practitioner role. And believe me, I have done it across the country for the past so many years. I will ask all the questions to Dr. Ravi that could be there in the minds of any private practitioner. Right? And if I miss asking a question, you please check me. So can we go to the next slide, please? And may I request Mr. Edwin, our IT, to make sure that all these people have the privilege to unmute themselves. So I welcome Dr. Basav Rajendra, IMA President. Next slide, please. We have less time. Dr. Swati Aital, I have already introduced. She is a WHO consultant to Chamarajanagar. Welcome. Mr. Harish, greetings and welcome. He is the Assistant Drug Controller, Chamarajanagar. So to all the chemists and pharmacists, I'm holding you as a representative to speak to you, to them, like I am requesting Dr. Basavarajendra for all the private practitioners in Chamarajanagar. Next, please. And Dr. Wasim, I am addressing you. You are a good friend, an old friend. And how we will be able to bring the college force, the workforce, the nursing force, the students to help Dr. Ravi. We in CTI can take them as interns. We'll get in the panel discussion. We are willing to grant them certificates. We'll involve you in discussions there also. So thank you for joining us. Next, please. Dr. Sunanda, very greetings. Thank you for joining us, and we will have your views that how certain cases which pass through you get missed out, okay, because it's a fact that the women folk in our country get to a doctor only when the problem is bigger, maybe infertility. They may keep coughing at home, they may keep sneezing at home, they may have a low grade fever at home, they may keep carrying the disease, but they will probably get to see the doctor only when it's a matter of infertility. And probably that is a time you may realize that there may be a gynec related TB issue, and how we can bring them to the fold of the facility, and what we can do. We will be taking your views. So thank you so much for joining, Dr. Sunanda.
Thank you, sir.
Okay. So, Dr. Ravi, my first question to you: I am a private practitioner, a very innocent private practitioner, who is not even aware that it is his responsibility, it is his moral obligation, it is legally expected from him by the government of the country and the state to notify TB cases. What will you do for me? And at the same time, I request Ekta to show the Gazette notification so that Dr. Ravi can give the answer. Yeah, Dr. Ravi. Dr. Ravi, can you unmute yourself? Okay, till the time he unmutes, I will answer on his behalf.
No, I'm not
It
able
is.
to unmute. Yeah, now I'm able to.
Yes, please.
TB is declared as and notified as a notifiable disease since 2012. When we have the target of eliminating TB, and when there is a lot of involvement of the private sector, and the private sector diagnoses the cases, and if it is not notified, we will not be able to take public health actions, which means that we have to do the contact tracing, then follow up of the patient until the outcome, what happens, and everything has to be recorded. So since TB is a notifiable disease, since 2012, we have every practitioner in our district who is registered under our KPME, Karnataka Private Medical Establishment Act. They will be called for regular meetings about the TB, about our NTP program, and we will sensitize them about how to do it. And also, we will give them the ID, Nikshay ID. Nikshay is the portal where everything is updated. When a patient is suspected to have TB, we call them as a presumptive TB, and the enrollment level has to start. The enrollment has to start from the clinic level itself. So we have given them Nikshay IDs and passwords, credentials, wherein they can enroll the patient. Once the patient is enrolled and the testing is done and test results are updated, automatically it becomes a notified case.
Thank you. Thank you so much. So, Dr. Basavarajendra, I don't know. Like I said, I am a very innocent private practitioner. Maybe I am a young private practitioner. So I didn't even know so far that it is my moral and legal responsibility to do so. So if I may request you that through your means, we can, share this information routinely, so that it doesn't go from our minds, that it is a Gazette notification. Para 3 and Para 11, for all you gentlemen, Para 3 is concerning the private practitioners, and Para 11 is concerning all the pharmacists and chemists. And I'll be bringing Mr. Harish in. So, would it be okay, Dr. Basavarajendra, to do this awareness information spread to all the private practitioners that it is their responsibility? And I'll come to the problems later.
Hello, sir. Hello.
Yes, we can hear you.
Yeah. So we know about all these notification and all.
Okay.
And we are screening our patients also. And we are uploading in Nikshay portal also. And we are supporting whatever the government is doing. Only problem is the private practitioner in Chamarajanagar, most of them comes under Ayurvedic. So it comes under Ayush. So that we have to involve the Ayush in charges also in this meeting. I think they are missed. And we have to
Okay.
educate practitioners, those more in especially in rural area. More of them are from Ayush only. So we have to educate them and we have to support them and we have to get back the things from these Ayush doctors. So that we have to involve Ayush doctors also under this forum because they won't come under IMA. So that I'm helpless to
Perfectly fine.
force
So,
the thing.
yeah. So I promise you that we will have a separate session for the Ayush doctors. In the last 2 years, the government of India has permitted Ayush doctors also, and all of them have been brought in the private practitioners scheme. Same benefits which are applicable to a private practitioner of any pathy is applicable to Ayush also. So, perfectly fine. Now, let me ask one more question. Uh, Dr. Ravi, I am a private practitioner. I am busy. Okay. And sometimes I know there is a patient, but I get too busy to enroll him in Nikshay. Can you help me? If I give
Yes,
you
of
the
course,
information.
yes, of course, we have been doing that. Once we give them the
Okay.
Nikshay ID and password, sometimes when they are not enrolling, if they refer a patient, our own people at the laboratory level, our laboratory technicians will enroll for them. Under there, if they properly send the reference letter, they will do, or our NTP staff will also do the enrollment. And also, if they become positive, they will inform them, and automatically notification will be in their name only.
Okay. So you are saying that, if I am a private practitioner who wants to notify, but I'm busy, so you will be able to help him notify, and yet the patient will continue to be the patient of the private practitioner.
Yes, of course, whatever the patient prefers, like the patient wants to, continue the treatment with him, we will provide everything, like the drugs or follow-up tests, everything is done by us. He can also regularly go and be in touch with the doctor.
Okay. So if I'm a private practitioner, my concern is that I will lose my patient, and there may be more patient in the family. I am their trusted friend. So how do we address this issue?
No, of course, I would like to tell you that when Dr. Basavarajendra was telling that we have been doing everything, and all the practitioners that we have called, those who are registered under KPME, Karnataka Private Medical Establishment Act, have been very, very cooperative, and they have never expressed these issues like the patient will not come back to us, because we have been very open. Okay, and we don't force. We always this program is patient centric. Patients' preferences and sentiments are the first priority for us. So if he tells that the government sector should not come to my door, I will continue my treatment with my private doctor. We will never object. We will encourage that, and we will do that. And it has been like that.
So good, wonderful. So I am just getting it, reiterated through you, and trying to get everybody together. So I am a private practitioner. I will not lose my patient. And the government is willing to help me bring the drugs also to my door to make sure that the patient gets all the benefit. And I'll come to the benefits of the private practitioner. They are very minor, nothing very great, but I'll come to that later. Uh, if I may bring Mr. Harish in at this point in time. Mr. Harish?
Yeah, Arogaji, tell me. I'm
Yes.
online.
And Dr. Basavaraj, I am only assuming that we have to keep TB always alive in the minds of the chemists and the private practitioners. Just nothing. It is to be kept alive so that they do not forget, oh, a TB patient is there, I have to notify. Similarly, all the chemists. So what if I suggest that you have WhatsApp groups? We will provide you a jingle and informatory message every 15 to 20 days. Can we just keep the group alive by those messages? We are already doing it. What is your view, Mr. Harish? Will it help the chemists and the pharmacies? Yes.
Yeah, Arunach is now already recently joined to Chamarajanagar, reported 1 month back. So it is already the WhatsApp group is very active. So we have already created another WhatsApp group for all the chemists, including all the talukas which is there in the Chamarajanagar. So almost all the chemists who are dealing with the drugs, they are already submitting the data to directly to the city and as well as to our department. So you can send any information, all those things to me or to the group. So it will be circulated and it will be presumed that they will be active.
Thank you so much. Now, in this digital age, when WhatsApp is there and all of us are there on the group, is it possible that moment a sale happens, or in 1 hour or 2 hours, instead of maintaining a register we have to maintain H1 register, we have to maintain. The information can get passed on to the DTC or to the STS of that area immediately, or in a span of early time, if we agree on a format between the DTC and the pharmacist and the chemist.
Yeah, it can be done. So now already every month there's submitting the details to the TB center also. So if you make it any suitable electronic media so that they can update it, so we can implement that.
Okay, Dr. Ravi, what will be your view? Instead of waiting for it at the end of the month, and it's a digital age, if we make a small format, or I can, if you want, we can make a small Google form. Very simple. Just select the buttons and the information will reach you. It will be residing in every mobile of the chemist and the salesperson in every shop. All he has to do is, moment TB drug, H1 scheduled drug is sold, he'll open his mobile, click few buttons, and information will reach you. How will that be?
Yeah, that's okay. That will be an additional tool, but we have been very meticulous, and the pharmacists and also from the ADC's office, we are getting good reports, and this will be an additional tool because there is since we are most of them are aware that drugs are available in the government sector. Very few chemists are keeping these drugs, and the sale private. The anti-TB drugs sale data is very minimal in our district. And even with that, whatever they are getting, they are keeping us informed. And this Google form might help. There is no issue.
Perfect. So, Ankita, please make a note of it. Ayush is one action which has come up. Google form is another action which has come up.
Yes,
If you can, Ekta, put the slide of the benefits to the private practitioner. And if I may request Dr. Ravi to just reiterate it to the private practitioners present here, and maybe we can present this slide number 34. Slide number 34. We can keep sharing it on and off. So if you can explain this, Dr. Ravi, to once again as a revision exercise.
Like whenever a case is diagnosed from the private practitioners side, we if a notification occurs, there is something called as the incentive for notification, which is 500 rupees. And if they also keep following up the patient and do at the end, like outcome, if they give from their side only, there is another 500 rupees for the outcome if they enter. And if they support the patient with any treatment supporter, providing a treatment supporter at their hospital, wherein we provide the drugs and one of their staff looks after the patient, directly observation treatment, that is dots what we give for the patients to ensure that they are taking the medicines. So for that, we are giving another 1,000 rupees for treatment support. And it's very less because most of the patients, they prefer either family docs or ASHA workers or the healthcare workers at their village level. So very few, I think, in private, they are taking providing treatment support on them. So totally that much of incentives is there. And apart from that, the patient will get the Nikshay Poshan Yojana benefit, which is now which was earlier 500 rupees per month for the entire treatment period, which the government of India has recently announced that from November, it will be 1,000 rupees per month for the patient for the treatment duration, which is for drug sensitive TB 6 months treatment. So 6,000 rupees they will get. And for drug resistant TB, where the duration is long, they will get for their whole entire duration of the treatment if they do not default. and take the medicines regularly. So whichever way private practitioners are, referring or getting the patients, they will get all the similar facilities which the government notified patients get. And these are some, a little bit of incentives which they are giving for notification and then for recording the outcome, and then also for if they engage a treatment supporter for the patient.
Perfect. Thank you so much. And if I may request that you have spoken more than what was on the screen. So would it be okay if we keep posting this regularly, into the WhatsApp group so that it stays in the minds and memory of the people, although it is not a
Yeah,
great incentive. Yeah.
yeah,
Okay.
it's okay.
Okay.
It's okay. It will remind them. So somewhere
Okay.
it may increase the presumptive examination rate also.
Yes, because that is your objective. We want, people to get encouraged to send the people here, to send the patient towards you. Now, I am Dr. Basiv Rajendra. I am going to ask a very specific query, maybe on your behalf, and then I'll get you in. So, Dr. Ravi, as I said, I am a private practitioner. Okay. And money does not matter to me much, as it is you are hardly giving me any money. And that also, I know that the government money will come when it has to come. It will not come immediately. But my concern is not money. My first concern was I don't want to lose my patient. Okay. That you have answered very well. Tell me, sir, you are needing my cooperation. I need yours. Would it be possible for you to treat my patient as a VIP patient when he goes for, I think, CB-NAT, or, can I send him for an X-ray to you or a blood sugar check to you? He is not from a very well-to-do background. Can you and I work together and help the patient like this? Can I take your help also?
Sir, of course, I told you this whole NTP program is patient centric. So that VIP status we give to everyone, irrespective of wherever they come, whether they come from the private practitioner. So I think in the beginning itself, I told in our district we are given clear instructions that any patient referred from the private sector should be attended on priority and given NAT testing, which we are not providing to all. So
Right.
any patient coming from the private sector is given priority, and all patients we take as much care as we can.
Yes,
There is no
absolutely.
compromise on that, and I'm very strict with that.
There is no compromise there. I fully agree, and I appreciate your thought process, because those are the ethics. But
We
yes,
keep in contact with the private practitioners. We have given them enough communication channels to get back to us, and there were instances where sometimes there were differences between our staff and the private practitioner, but there were some communication gaps. But we keep addressing all this, and till now we are in good terms.
wonderful. So, because this multi-sectoral approach is towards removing misconceptions and miscommunication, of coming together, holding hands, forgetting differences, and cooperating towards a common cause. And we are here to seek cooperation from the private practitioners and the pharmacists. Okay. So, fine. Dr. Basava Rajendra, any query right now here? Yeah.
Sir, there is no queries. As Dr. Ravi Kumar said, the most of our patients, we will collect the sputum and we will send only the sputum. Most of the time, we won't send the patients. And the X-ray, anyway, we tie up with the government also. We are doing free of cost for these patients. So we have a MOU last month only, and we are doing free of cost. So whatever the patient expects in a private, we will fulfill in our private only. Only we will take help from the government only for the sputum and CB-NAT reports. After getting the reports, anyway, they given the medicine. We only start the medicine. And sometimes if it is far away from my place, I will refer to the local PHC for the continuation of medicine, so that there is no problem for the patients. Only thing is we have to guide them and we have to communicate them. We are doing it, and we are getting good communication from the health sector, and also Dr. Ravi Kumar is very active. So we are doing well, sir. Only thing is the clinic practitioners are not coming in with our waves. So we have to streamline these clinical practitioners, and we have to get the support from these people, sir. In that way, we are arranging the meeting, and we are seeking their help also. So in future also we will continue same thus.
Okay, great. So clinical practitioners is where the issue is. Uh, all I would be requesting, Dr. Ravi and Dr. Basavarajendra,
So
you have WhatsApp groups of the clinical practitioners also. They are the part of the WhatsApp group.
yeah, we have, sir.
All I request is if each one can just share with us the location of their clinic once they go to the office in the WhatsApp group, just share the location. And thereafter, Dr. Ravi, I will discuss with you how we can reach out to them personally. We can spread awareness, get them into the main fold because it is all a matter of spreading awareness because everything is all the protocols are there by the government of India, all the policies are there. You are a well-meaning person. Dr. Basav Rajendra is cooperating. So all the clinical practitioners, I'm sure they are not aware. So all I'm requesting, Dr. Basav Rajendra, is one thing that all practitioners are just told, just share the location of the clinic. Then we will geographically distribute them. I have a plan in the mind. I'll not waste everybody's time right now, but we will reach out and we will do uh, screening of the areas geographically through their help. Would be possible, sir.
Yes, sir, it's possible, sir.
Great.
Please get the Ayush doctors also in this panel so that it's a very helpful for us, sir.
Will include eyes also. Yes, yes, yes. Ayush, sorry. Absolutely. Okay. So, Mr. Harish, and then I will bring Dr. Wasim and Dr. Sunanda. Mr. Wasim, what else, Mr. Harish, what else can be done? And a positive action only. I am not requesting you to threaten the chemist or the pharmacy that their license will be, taken or something like that. That is not the intention. Everybody is aware of, the gazette notification and their responsibilities. What else can be done with more positive action so that more reporting happens from their side? Is there anything that you expect from the health sector or from the DTO that we can fulfill for you? Mr. Harish, can you hear me? Edwin, Mr. Harish, can you locate and unmute him?
I don't see him.
Okay, not. I think he got off. Okay, so Dr. Wasim, unmute Dr. Wasim and Dr. Sunanda. Is there anybody else I'm missing to call upon? Ekta, Ankita?
Dr. Swati.
Dr. Swati, I've already taken her views. Dr. Swati can also come in, please. Okay. Dr. Wasim.
Yes, sir.
What are the courses running in your college?
Sir, usually we are having MBBS and MD in various specialties. Uh, so from our side, as sir was telling, because medical college being a major chunk of the TB cases being found from the medical college. So here in medical college, the main activity will be done basically by the PGs as well as interns. So these being the main doctors who will be identifying the cases. So on that part, myself and Dr. Ravi sir already we have done awareness program, especially the sensitization has been done for the interns and PGs. Like every year, how many interns are like every year interns are being new interns will be posted as well as medical PGs are being trained. So these people will be sensitized regarding what actually the updates to be done and how to go for inpatient screening. All these are being done. Even the UGs, like medical college MBBS graduates, those who are studying, these people are also being sensitized. As well as recently, like for the TB World TB Day, we had also organized a TB quiz for these students. And also, as we had told, even the nursing faculty are also being trained. A TB sensitization program for nursing faculty also being covered up in the last time. And also, like awareness, actually, we have also planned for a community awareness program. Like we in Chamarajanagar being a tribal, because we are having more amount of tribal population. So, like what I request our Ravi sir, DTO sir, to give more amount of more importance towards these tribal population, because here the awareness among the tribal population about tuberculosis is not as such. Yeah, Gram Panchayat activities, all these being done, but yeah, tribal population, I don't think so. We are we are more towards that. So recently we had a camp also for tribal population that was related for sickle cell anemia. So related to TB, we can plan for tuberculosis even for the tribal population, that can be thought of. Remaining things that we have a regular meeting with or like a core committee meeting is being conducted. So all the medical college faculty are being involved. So they are being every time Ravi Kumar sir will be asking them for identification more amount of presumptive cases, inpatient screening, as well as even with the TB patients with comorbidities, those to be identified. And also, recently, sir had also asked for a DRTB ward. Our Dean sir is more keen towards identification of DRTB ward. That also will be soon set up. Quality microscopy as well as CBNet is already being done. So from our side, what we can do is like we can help you out with like more amount of what we can do is like awareness activity for the interns as well as nurses as well as at the community, that can be done from our side, from medical
Okay.
college.
Thank you. Thank you. So
Yes,
may I request Dr. Ravi and Dr. Wasim to hear me out? Uh, uh, you know, I will now say, Dr. Wasim, what I can do for your students. Okay. You heard that, our organization and myself and Dr. Manoj, we are teaching the Harvard scholars right now. Okay.
yes, sir.
The PhD scholars of Harvard who are, have done cardiovascular diseases and, other things. We are teaching them quality improvement, and the session is going on.
Yes, sir.
We are teaching in Emory University also, and we have global recognition.
Yes,
And
sir.
even this program, CAP TB project, is WHO and Central TB Division approved, Government of India approved. Uh, so if I ask for volunteers uh, from your college, and let us imagine Dr. Ravi Kumar is planning a workspace screening in an industry,
Okay.
okay? Because an industry is organized sector, right? We have to just reach there. We have to make sure that everybody is screened. Industry can offer their own medical officer also. They may have an ambulance also. They may have some volunteers. So in 2-3 days of a camp, we can finish off, 1,000 people
Yes, sir.
straight away.
Yes,
Declare
sir.
them as TB screened, organized industry.
Mhm.
Our presumptive will go up in 3 days, 1,000. But I will need qualified manpower.
Yes, sir.
And you mentioned your PGs and interns.
Yeah.
If I'm willing to give them incentive for their
Mhm.
cooperation
Yes.
and a certificate signed by us with all these logos that I mentioned, right? So
Yes.
that their resume can talk about it. Their interview and their cooperation and the cooperation of you, your faculty, your dean, anybody else on our website as and also on YouTube for the cooperation that you're getting. Uh, would it be possible, as I mentioned in the beginning, that through colleges and medical colleges and private cooperation, we could manage 40 such volunteers where only two NTP staff were there and we did the workspace screening. We need ambulances. We need people on motorcycles to carry sputum samples. We need PGs and interns to, do the questioning, symptomatic questioning, and, then refer them for, further checks and everything else. So imagine workspace screening is going on, 10 tables are set, and each table has a team of one doctor or a PG or an intern with one nursing staff and one helper. Would you be able to uh, commit yourself towards this? My question to
Yes,
you.
sir. Yes, sir. Actually, like we every month from our department, we are we are almost handling 30 interns. So they are posted various PSCs, like almost like the Taluk hospitals and various PSCs, we are posting them. So obviously for manpower for interns as such, we can give the interns as well as for PGs. Actually, like clinical department PGs as well as our PGs, we are having a good number of PGs. So even those people can join hands for whatever the activity what we are planning to do. So those things we can help you out. Even for screening, for else for identification, for notification, all those things can be done from our side. from medical college side.
Great. Thank you. So, Dr. Ravi, from SETI's side, I am committing that we would be willing to incentivize these interns and whosoever comes from Dr. Wasim's side and from any other college we get, including the CHOs if they volunteer, so that we can create a workforce for you and give them a certificate of participation as an intern or whatever, and including a certificate as you see on the screen to the industry that gets work screen, TV screen. We'll be requesting Dr. Chidambara for his signatures also, so that it becomes motivating for people to come forward. Dr. Sunanda, can I get you in? And thereafter, we will close the session because it is getting late.
Yes, sir. Very much
I
here.
have brought you last so that
No
you
problem.
can give your perspective totally, and we're all listening because there are private practitioners also where the women folk go, and they may get left out. So whatever is your view for us, for Dr. Ravi, for the private practitioners, for the pharmacists, chemists, and how you can contribute everything, all my questions in one go. Over to you, ma'am.
Thank you, sir. Good evening to everyone, and thank you, Raman sir, for including me in this panel. As a gynecologist, I would say that the incidence of the tuberculosis we picking up as an early diagnosis is quite rare, and majority of the time we get the referral from the Department of Medicine that the patient has been diagnosed and she's been put on drugs. So once in a while, when we are evaluating a patient of infertility, probably we might pick up a case of genital tuberculosis, that is an extrapulmonary tuberculosis. So recently, to tell you, a week or 10 days back, when I did a laparoscopy for a patient who has been referred with primary infertility from Kollegal, that too. So I diagnosed that the patient is having abdominal and pelvic tuberculosis, and I took the biopsy. And to our surprise, like when I suspected tuberculosis, the ESR when I did it just came as an 8 only. So the physician was hesitant to put her on antitubercular drugs till the HPR report would be available. But I just put her on AKT and I referred to the place where she came from, to the PHC. So there she received the antitubercular drugs, and right now she's on those drugs. And the HPE turned out to be its granulomatous lesion. So generally, we when we evaluate the patients of infertility, then only we'll get an idea of the amount of tuberculosis affecting the women population. And with respect to the obstetrics, hardly we get patients who are having open tuberculosis and who are on medication. And the ANC care generally goes the same way as we do for the other patients, and we make sure that the patient doesn't have any complications as a result of the active disease. So I think if we pick up the women who are having this primary infertility and we make an early diagnosis of the genital tuberculosis, probably most of the cases we can pick up and we can eradicate the tuberculosis. This is my view, sir.
Thank you, ma'am. Thank you so much. Dr. Ravi, from Dr. Sunanda, would you have any more expectations or from Dr. Wasim?
No, sir. Whatever they have said is quite encouraging, and that's enough.
Okay, great. Any other participant present here can raise hand if anything that would like to say. Dr. Chidambara, can I request for your views, concluding remarks, and then I'll bring in Dr. Swati. Dr. Chidambara, if you can hear me.
Yes, sir, I can hear.
Yes, sir. Your concluding views.
Discussion is fruitful, and we need to carry on the inputs what we get from these discussions. And implementation is again that's the challenging thing, and we will try in that. Thank you, sir. Thank you.
Thank you. And from CTI, we promise you and assure you every possible support. We have certain skill sets which are very much in demand internationally. With all humility at our command, we lay all the skill sets at your disposal, Dr. Ravi, and we'll make sure that whatever is your thought process, whatever is your plan, we'll try and catalyze it. Dr. Swati, any concluding views, remarks from your side?
Yes, Ramanji. just to add on what DTO sir and the gynecologist Dr. Sunanda was emphasizing, I also want to stress on the sample collection. Then I saw Dr. Basaraj mentioning about sputum sample being collected and then being sent for testing. But also I would like to stress on the extra pulmonary samples. So if that also could be channelized, it would be great. Because I see Dr. Sunanda, she mentioned that, she had sent infertility case, and AKT was started and other things. So if that sample also can be, collected and sent to LPA, there only in the culture DST lab, culture can be done and all the tests, including NAT, can be done there. So this is for all extrapulmonary samples. So this one point, if we can stress to private practitioners, because I see more of extrapulmonary cases coming from them, and some of them are, clinically diagnosed. They have the idea that yes, it is probably TB. So, but since we have a provision of actually doing a microbiological confirmation, so I would like to stress on that point here. That's it from my side, Ramanji. Thank you so much.
Thank you.
Thank
you,
you
Dr.
all.
Swati. Dr. Ravi, I invite you for your concluding remarks for everything that has been said, promised, observed, and over to you. And we'll close the session.
I'm very grateful to you all because I have been getting the right support from everywhere, especially from our district administration. That starts with our Honorable DC Madam. She has been, like whatever we ask for the program, she is always very encouraging, and she has supported the program a lot. And she always looks for, whenever I ask anything in the meetings, she will say we will do it on priority. And I'm very grateful for that. And also our new CEO, Madam, who has come recently, she has also been very encouraging. And Madam left the meeting because she had some other personal work. And our DHO sir also has been supporting our program. Today, actually, yesterday and today, we were holding trainings for CHO's first batch. And sir came and addressed the CHOs, which makes a huge difference to the program. So he has been very encouraging. And our WHO consultants, right now we have Dr. Swati with us, but there have been WHO consultants who are always given us technical support and inputs from the state and the national level. And I'm grateful. And also especially for the private practitioners, whenever we have approached them, they have also been cooperative, sending cases, involving in the program, coordinating with our staff. And whenever issues have arisen, they have not made it a big issue. They have always given us space to solve them. And ultimately, it is the community which should get the benefit of the whole program, where we are eliminating the TB. And I thank everyone, especially SETI people, for having involved me from that beginning when you trained all DTOs about PDSA, then took our district along with myself for CAP TB project. And the way you have been approaching us, there were some issues, and I have discussed with you, and I think we have sorted them out. So we are on a path, and we will continue this journey, and we will help the community together. And I thank you all for all the private practitioners, ADC, pharmacists, and our staff who have joined, and the entire SETI team, especially to Manoj Jain sir and also Salil Bhargav sir and your team, everyone. Thank you very much.
Thank you, Dr. Ravi. Thank you so much. May I request Ankita to give a vote of thanks and just stay for 30 seconds more, and then we'll close the session. Ankita.
Yes, sir. We extend our heartfelt gratitude to all the dignitaries present here. Thank you, Honorable Shilpa Nag, Madam, DC, Ms. Mona Raut, CEO, Madam, Dr. Chidambar, DHO, Sir, for your insightful inputs that you shared with us. I also extend my thanks to AHT team, our donors, Dr. Ravi, DTO, Chamarajanagar, Dr. Basav Rajendra, IMA President, Mr. Harish, ADC, Dr. Wasim, SIMS Nodal Officer, Dr. Sunanda, MOX President. Thank you all the private practitioners and all the chemists who joined us here. If any gynecologists are here, I would like to sincerely thank you. Thank you to all the stakeholders. And if I'm missing out on anyone, thank you everyone for your support. And I hope you will continue to support us and we can make Chamarajanagar TB free and ensure a healthier future for all. Thank you so much.
Thank you everyone. And I would like to say good night to you with a simple request. I am not even a doctor. So first of all, I bow down to all of you for your professionalism. Uh, we are only focused at making this country TB free. We are the same people who are launching satellites to the moon and to Mangal Grah. We can do it together. All I am requesting is just keep it in your mind that we have to fight TB together. Your small effort of 1 second, 1 minute in a day will make a difference. With this, thank you everyone for your patient listening and participation. And we will keep the drive going and keep it forward looking. Thank you, everyone. Thank you so much.
Thank you. Good night. Good night, everyone. Thank you.
Thank you, Dr. Ravi.